public health physician and epidemiologist, who is also a retired Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. Dr. Emmanuel Abanida joins us now. Good evening, Doc. Thank you for your time and welcome to the program.
Very much.
Let me have your take on this resumption of interstate travel. I don't know if you heard Dr. Roberts, who's just finished speaking there, saying that, look, it's good to open this up. It was sort of open all along, but that there is a real fear that the facilities are not there to ensure that this can be done safely and cleanly, so to speak.
Well, I have heard what Dr. Alero said about the interstate travel and the level of preparedness that Nigerians are putting into it. I believe strongly that the relaxation of the lockdown that we had before, the evaluation, and when we extrapolate it to the next level of the lockdown that is taking effect from tomorrow, we have a lot of lessons to learn. Let me first of all just point out that many people have the contention that another lockdown may not sort out our problem. And even interstate travel restrictions and all the guidelines may, at the end of the day, not sort out all our problems. Because all along, there have been interstate travels, we all know. People travel from Abuja to Kebbi, they travel from Abuja to Bayelsa. All what they need is extra coins in the hand. Because those who are supposed to oversee or to have a foresight to enforce that these guidelines or these laws in quote are obeyed, they themselves are at fault. Now, it is going to be very difficult to really put infrastructure in places for interstate travel the way we have them now. If you want to have good structures, as we have in the Western world, you know, a distance from Abuja to Kaduna, for instance, we have about 3 or 4 lay bays where vehicles can stop and people can freshen up and people can wash their hand and people can take fresh air. Because if you have to travel for about 1, 2, 3 hours in a crowded bus without enough aeration, no matter the level of the gloves and no matter the level of the face mask you put, there's still that risk there because distancing is not there. And we know that in the crowded environment, the virus particles, they shed faster. However, because we cannot avoid this interstate travel because of the nature of our economy and the nature of our living, is that people must take personal responsibility. What I believe that government can do is to increase the level of awareness and let people know that COVID-19 is real. People are still doubting it. People regard it as a political disease. People regard it as a disease of the elites, a disease of the big people, because they see in the news and the media that somebody has died, the governor, somebody has died, is this and that. But they have not realized that there are so many people that died that are not reported that are also in the lower class. So I believe that we need a lot of education to all Nigerians that COVID is real. And when people are educated and they know the effect of COVID and what it can do to them and to their families, and if anybody is positive in the family, everybody goes on isolation, then people will take personal responsibility. It is not an easy thing at all. Well, it's very easy to put on paper and say interstate travel, people can travel. I do not see a hike in the number of cases, even when you, when you do a lockdown now, because the lockdown we had the first time, I'm not sure it was extremely very effective because people were still doing whatever they like. So those are my takes about this lockdown and this interstate travel. Finally, on this interstate travel,
sorry, let me butt in. Dr. Badia, let me butt in and ask you this, because your last point was that, well, they have to do the interstate travel because of the architecture of our economy and so on, that we've got to travel. But if you take that side by side with the fact that this active, as you said, active community spread is going on right across the country, as the figures that we keep reading every day are showing, does it then make sense to exacerbate the situation by allowing this, especially given what we are seeing in other jurisdictions like the United States, in Brazil, Germany, and a number of others where they've gone forward, they've had to come back?
Thank you very much. Let us be very frank and very practical and be truthful. The interstate travel reduced during the last lockdown, but there were people who are still traveling. We are worried that when you institute this interstate travel and people now move, certainly it will have some negative effect on the case count because more people will now be crowded together. I get worried about it. But if you don't have any very organized system where you can track or where you can monitor how people are moving, where you engage the critical stakeholders in this interstate travel process, especially the National Union of Road Transport Workers, the drivers, and so on and so forth, it's going to be very difficult. It is not easy to monitor this. We need to engage those people who are in that value chain, in that interstate travel chain, the drivers, the union, and the passengers, that's number one. Critical also is the need to reorientate our security forces, our law enforcement agents, where they can make everything to be a mess. If you say people must wear masks when they are inside the vehicle and you must take 2 people at the middle, 3 people at the back, and the driver takes 3 people at the back and 3 people in the middle, those extra ones, they are sources of revenue for some of the law enforcement agents. That's the truth about it. And there's some people who say, well, I don't care. You put the money there and I just give it out so that people can have it. So I believe that we need to have a lot of reorientation, both for the law enforcement agents and also for the stakeholders in this interstate travel. Government has a responsibility to make the guidelines, but the only responsibility government has in ensuring that these guidelines are followed is to put the law enforcement agents road and provide the infrastructures as much as possible. And I think since this one has become a normal norm, as people now say, we may have to look at our transport infrastructures. Because studies have shown that when you have long buses or long commuter buses, they are far safer in terms of disease transmission than these crowded small vehicles. But how long are we going to do that one? We cannot say everybody cannot access these long buses. And so those who are using these small buses, small vehicles, have to be well educated that they need to take personal responsibility.
Now, at this point, we do know that you were one of the top shots at the Primary Healthcare Development Agency. You were, in fact, in charge of disease control and immunization. So my next question is right up your alley. How prepared do you think our primary healthcare centers are at the moment for taking, quote and unquote, responsibility if this increasing caseload begins to leave the urban centers and it moves to the semi-urban or rural areas where they appear to be the only health institutions that are available?
That is a big question, and it is, to be very frank with you, I'm not sure that we are prepared all over the country for this. You might have some centers that are maybe prepared, those that are in the urban centers, but those that are deep in the rural areas or far away, I'm not sure they are prepared. I'm aware that the National Primary Healthcare Development Agency has done a lot of training and training of trainings for the primary healthcare workers at all over the whole country, so that they can use the triage system to ensure that, peradventure, people come in, really pregnant women or people that are vulnerable, they come in and they have symptoms or something similar to COVID, what they need to do. God will not allow it to happen. I'm not a prophet to pray, but I'm not sure that along the line Nigeria is prepared to take the burden of a full-blown COVID, community transmission, and the outcomes in the country. We are about 200 million Nigerians, and by our estimate from the figures we are getting, if you have a full-blown and you expect about 40 million Nigerians to be infected, of course, 80% of these may be asymptomatic, but the remaining 20%, they are there. And if you look at our data for the case fatality rate that we are having is between 0.6 to about 3.4%. So one may expect that if you have a full-blown in the country, we might be having about 3 to 4 million people dying of COVID-19. That is very scary. So I believe that a lot of responsibilities are still there, and I'm not sure that the primary healthcare centers, without PPE, without all the equipment they need, without the drugs, without the state training and motivation of the staff, can handle a full-blown COVID. We want to raise the bar or raise the line, as you said, by recruiting and ensuring that our health facilities can cope with cases of COVID-19 if there's a full-blown. Trainings have been done, but what is the level of implementation that can be carried out at the primary health care center level? Akin to this is the issue of commodities. You may have training, but the commodities, they are not available. I think the easiest commodity that are available almost everywhere now is maybe the thermometer that you take the temperature, the face mask, and perhaps maybe the surgical gloves and sanitizer. But if you have real acute case, real severe cases of COVID that might need intensive care, primary health care center cannot take care. So they have to be referred to other things. One challenge that the primary health care center also have right now is the issue of rejection, and because of great abundance of care and abundance of caution on the part of the primary health care workers. Anybody that has malaria now is a suspect, or anybody that has a symptom that you cannot tie to anything is a suspect. And so it's going to affect even the level that the primary health care workers are given at those stages. So all the same, I think we are just in a mess if this COVID-19 spreads, the community spread goes beyond what we have now. My take is that I'm not sure that we're going to have more cases that are fresh and that are new. The new cases that we are seeing now, new in quote, are those cases that have not been detected, but they're in the community. But if we reach maximum number of people that could be infected in Nigeria to have the herd immunity, then we're talking of close to maybe about 140 to 150 million Nigerians that will be infected, so that everybody will be protected, except we have the vaccination. So to answer your question and to summarize it, yes, the agency is trying its best to ensure that the primary health care centers are prepared for cases of COVID if it becomes full-blown, but I'm not sure of the level of implementation based on what we are seeing as structures around the COVID-19 disease itself.
All right, Dr. Emmanuel Abanida, thank you so much for your time and for your perspective tonight. Dr. Abanida, of course, is a retired Director of Disease Control and Immunization at the National Primary Healthcare Development Agency, and he's also an epidemiologist and a public health physician. Thank you for your time tonight.